Is Dr. Keisha Callins. She is a physician and public health professional. As an OBGYN with community health care systems, she's committed to providing health services to rural and underserved areas in central Georgia, with practices in Twiggs and Jones counties. She is the current Joy McCann Endowed Professor, serves on the faculty as professor at Mercer University School of Medicine, and is the faculty advisor for the OBGYN Interest Group. Dr. Callins is the immediate past chair of the National Advisory Council for the National Health Service Corps and a former National Health Service Corps scholar. She was governor appointed to the Georgia Composite Medical Board in 2014 and the Sandra Dunnigan Deal Early Language and Literacy Board in 2017. She serves on the board of directors for Bibb County Medical Society, the Georgia OBGyn Society, Georgia Health Initiative, People and Pets Project, and Georgia Watch. Locally, she provides gynecologic services to patients at the Bacon Volunteer Clinic and through the CHCS mobile unit for residents of the Brookdale Resource Center. Dr. Callins earned her Bachelor of Arts degree in biology from the University of Virginia, Master's in Public Health degree from the University of Alabama at Birmingham School of Public Health, Doctor of Medicine degree from Morehouse School of Medicine, and graduate medical training at Morehouse School of Medicine OBGYN residency program, where she served as chief resident. She's actively involved in pathway mentorship, translational research, legislative advocacy, and community engagement. She's a wife, mother of a college freshman and high school freshman, dog mom, and her hobbies include reading, cooking, and gardening. Her personal mission statement is, "You may not be able to change the world, but you can change the world of everyone with whom you interact." Please welcome to the stage Dr. Keisha Callins as she presents the Breastfeeding Birth Plan.
Good morning, everyone. I think we can do better than that. Good morning, everyone.
Good morning.
Excellent. So the good thing about being the first speaker is everybody's awake. The bad thing is I am the first one. So hopefully it goes well and we will have a good day. If we could go to the first slide in the deck. We're going to go back again, the beginning. One more. Is there another? Okay. Let's see. Okay, perfect. Thank you. Okay, oops. All right. So I had a very special slide that apparently is missing, so we're going to go forward and see. Maybe I don't know how to use the clicker. Let's try again. Oh, perfect. Yes, thank you. So the G is at the bottom, but have you all seen this billboard on the highway anywhere? So I'm from Macon, and this is one of the billboards that's on one of our streets, and I love this. It's really looking at a natural disaster. Now, when I did this presentation, I actually kind of crossed out the natural disaster, and I wanted breastfeeding to be there because I thought if we could have a really nice billboard to promote breastfeeding, this is what it should look like. So I kind of stole that idea. How am I going? Perfect. So the title of our presentation is the Breastfeeding Birth Plan. And I wanted to spend some time today just really kind of delving into the idea of why this might be an appropriate approach for us as we work on promoting breastfeeding. So I want to set the stage, and I want to give full disclosure. So Claire Eden is one of my very dear friends, and she's the one that voluntold me for this presentation. She said, well, the Australian Breastfeeding Society has this really good breastfeeding plan. You should look at it. And so I wanted to give her credit, of course. Is Claire here? Okay. Would you like to stand for us, Claire? Claire is a breastfeeding champion. I told her I was going to call her out. But I really think it's important for us to be able to think about why planning is so important. And I want to read for you these bullet points, and you'll have this presentation. It can help to identify your needs and preferences, understand how breastfeeding works and what normal What's normal can help you avoid problems. It can help you gain support of your partner, family, and caregivers, and you're more likely to meet your breastfeeding goals. And all of the things that I've mentioned in the presentation are hyperlinked, and there are resources at the end, so you'll be able to access everything. So just really want to set the stage for this idea. Our objectives today: I want to introduce the concept, discuss the purpose, review the design, practice developing a plan, and then how do we promote utilization of the plan. So, plan is not a bad word. So I know as an OBGYN, sometimes when patients present with a birth plan, people roll their eyes and they get nervous. So plan is not a bad word. We have wedding plans, we have business plans, we have strategic plans, architectures have plans, lesson plans. We use them all the time. So I want you to put away that idea that you may have of, a plan. What does that mean for me, and how do I engage with my patient? And really just be open-minded as we go forward. So even though the title says Breastfeeding Birth Plan, as I did my research for the presentation, I came across a lot of terminology that I think is important for us to consider. And so breastfeeding birth plan is one, chest feeding plan, lactation plan, nursing plan, infant feeding plan, infant nutrition plan, newborn feeding support plan, my favorite, postpartum vision board. I just thought that was beautiful. Had not seen that before. And what you can't see, it's whited out, and I did that for emphasis, but I want you to fill in the blank. Maybe there's another term that you could think about. And so even though that's the title of our presentation, as you leave today, I want you to take away what would be most appropriate for your population, for your patients, for your community, and be able to individualize the plan accordingly. So, according to my yoga mentor, JD, I'll give him credit, he always says, do what serves your body the best. So do what serves your patients the best. And one of the things that you will learn about me, for those of you who have not met me before, I love quotes. I have them in my head all the time, and I have papers of quotes everywhere. So I've sprinkled a lot of quotes throughout the presentation today. Before anything else, preparation is the key to success. And as we think about the challenges that we encounter with breastfeeding, this is exceptionally important. My son had a difficult time latching in my first pregnancy. I was a medical student at the time, and so I was an exclusive pumper, and that worked well. He still got his milk. My daughter was a little bit chunkier and greedier, and so she had a great latch, and we did fine. So your individual breastfeeding experiences actually can change with each pregnancy. So what's the concept? So, aren't we all planners? Now, as I did my research, I really got into thinking about what exactly does a plan mean. And I really love this slide because there's strategic planning, which is looking at long-term goals. There's operational planning. But the two things that I think are most applicable to breastfeeding would be more like tactical planning and then also contingency level planning. And that last one in particular, how do we help our patients overcome the barriers? Those barriers may happen on the weekend. Those barriers happen at 2 a.m. Those barriers happen when you're in public. What do you do? How do you address those things? And being able to kind of have an assessment or an anticipation of what will happen allows us to have some things available. And if they don't have the skills, then they need to be able to have a number or someone they can reach out to be able to support them during that time. So, what's the important question? And this is something that we hear a lot after we deliver a baby. We don't want to say breast or bottle. I think you all probably already know that because we're kind of pigeoning people into making a choice and setting them up as which one's better or worse. But we want to ask, how are you going to feed your baby? The other thing that's really important, and the reason that this talk today is planted strategically, is when do we ask that question? How do we optimize the response and the building that happens with that question? And so it really needs to be happening in the prenatal period. We don't need to try to suddenly acquire all those skills the moment that baby is born. And then mom is going home and she's postpartum and his hormones are everywhere and the dynamics are out of whack. We really need to have that in place ahead of time. And so really, as early as we can. So in a lot of the reading that I did, 28 weeks seems to be a good time. So in my mind, I'm thinking before they have the baby shower, so they can like plan the registry, right? So they can get the things that they need, that they've identified on their plan. But we want to give enough time to be able to link to resources, do breastfeeding classes, get the support they need, join a group, get on a Facebook group, whatever it is that we need to do, that needs to really happen early in the process. If plan A doesn't work, the alphabet has 25 other letters. So that means our patients need to understand if we have an issue, we go down B, C, D, hopefully we don't have to get to Z. But I love this because it really gives you perspective for how often we can change and update what we're doing to help our patients achieve their goals. Now let's talk a little about the purpose. And I am going to borrow this concept. One of the things that I came across, and I really love this idea, the state of Michigan actually has a breastfeeding plan for the state. And I think that's a really good idea for us to have a collective, collaborative goal for how we will approach breastfeeding. And there are a couple things in this particular paragraph that I think are important. Evidence shows that breastfeeding provides many short and long-term maternal and infant health benefits, as well as economic and community benefits. I think a lot of times when we think about breastfeeding, people think about the immediate benefit. Yes, it is infant nutrition, but there's so many benefits to mom. There's cardiac benefits, there's chronic health benefits, and of course there's benefits for baby. And so really being able to promote those things are important. And what better time to promote those things early in pregnancy when you have that captive mom who's preparing for her baby. The other thing that's really important here is their plan is guided by the vision for removing barriers, advancing equity, and promoting breastfeeding as essential for infant nutrition, social emotional health, and chronic disease prevention. Very key items. This report is probably about 18 pages, also linked in the resources, and so I encourage you to take a look at that, and really, we need to be putting our heads together about how we develop a state plan. Another quote, "A goal without an action plan is dead. So we have ideas, we have things that we want. We want our moms to breastfeed for at least 6 months, but now the new recommendations are we really need to be pushing closer to 2 years. That is easy to say, but in our culture, it actually might be a little bit challenging to do. So if we want moms to succeed, we have to set them up for success. Let's talk a little bit about the design. And I'm going to delve into a little bit of the resources that we use as OBGYN. So ACOG has some publications that I think are really key. These are also linked in the resources. So there's actually a really good segment that's on optimizing support for breastfeeding as a part of obstetric practice. And I think it's important because, unfortunately, in our training as OBGYNs and probably other fields as well, there's not a lot of direct breastfeeding training or infant feeding. We learn about the mechanics of delivery, but how to support our patients and how to troubleshoot, how to have that conversation really is something that is still lacking in our medical education. And so our wonderful faculty like Dr. Bird will be helping us to make those changes. Also at GOGS, we have a breastfeeding medicine committee, and we collaborate with our education committee, and that's one of the goals that we have is to continue to educate our future clinicians. There are a couple of points in this particular committee opinion that I think are important for us to focus on. And I selected the segment on prenatal care. And as I mentioned before, my suggestion is that we really start right about 28 weeks. And it's really important for the obstetrician or the women's health provider who's evaluating that patient to really spend some time here, because we really need to know the family history. We need to know the patient's medical history. Have they had a history of a breast reduction? Have they had any kind of breast surgery? Do they have any chronic conditions that could impact? Are they taking any medications that could impact their ability to produce milk? So if the patient gets a plan online and they start filling it out, but it doesn't address those medical conditions, then we're setting them up for frustration, and we might even be setting them up for failure. I had a case recently where it was actually a friend of mine, her daughter delivered, and she ended up having a preterm delivery, which is not uncommon, and was trying so hard to make milk. Her breasts were engorged. She called me on a Friday night. The mom called, ended up calling Clear, I think, maybe on the Saturday morning at like 7:30 a.m. And just in doing my phone history, and she was not my patient, but the mom asked me to help, I found out that she had had a breast reduction. And she was a young patient, and maybe the counseling she received, she didn't anticipate that portion, but she actually was not able to because the architecture of the breast had changed so much that she was not able to express any milk. So how do we prepare our moms for that? And that's one of the reasons why the 28-week mark is a good time to introduce, because should we end up in the camp of having a premature delivery, we have an opportunity because they already have a plan. And of course, we talked about contingency, so being able to know that history, figuring out what support they need is really important. And as I mentioned before, a lot of the challenges happen on the weekend and at 2 a.m. So what do? How do we make sure they don't fall apart? And I remember when I had trouble breastfeeding my son, it was very distressing. I was young. I thought I was a bad mom. I thought I wasn't doing it right. But it took a Herculean effort for me to even pump. I was taking fenugreek. I smelled funky. I was taking Reglan. I was in school. I was half asleep. It was difficult. And so, how do we get our moms to push through that? And let's not even talk about the nipple discomfort that comes. I didn't know that was coming either. And so really being able to anticipate those things is really important. I've learned those things from my personal experience, but if we want to really increase our breastfeeding rates, and also if we want to combat the discouragement that people will receive when they try to breastfeed, we really have to help with that anticipation. So I encourage you to spend some time to review this article. This other page I like, that's very important too, because it really delves into the importance of the OBGYN's role. And so it's not enough for me to say that I was not trained in that. I now have a responsibility to own it and to really work with the appropriate resources and the appropriate people who are trained to make sure that my patient has access to what they need. So if I don't know something, I usually will call Claire or Dr. Farley, but excuse me, you do have to get that information. We have some really good articles that are printed in our GOGS report if you haven't had a chance to look at it. And there's a segment on how to get credentialed and become an IBCLC. And so really, there are lots of levels of entry points for how you can provide breastfeeding support. And one of the things that might be helpful is for the healthcare team is we decide who is that designated person. With the Medicaid extension that we now have for 12 months, we should be able to work into that, the billing and the practice management piece that allows for that to actually happen in a good way. I met a physician in Statesboro last week when I presented at a conference, and she has a whole list of codes that she uses in her practice. And so I actually sent her a link for the Georgia OBGyn Society membership so she can join so we can get her information. But it really is important for us to really promote that practice management piece. So goal setting is the most important aspect of improvement and personal development plan. It is the key to all fulfillment and achievement. And we'll get into plans in just a few minutes, and we really want to be reasonable. Sometimes it might be better to have a short-term goal. If you have a patient that did not have success in breastfeeding with her first pregnancy, then the goal might just be for her to breastfeed for 4 weeks. That's achievable, and then once she conquers that goal, we can move forward. So a lot of the things that I'm mentioning really fall into the category of motivational interviewing, and that's just the public health training, but also really how do we empower our patients to achieve the goals that they want? Because some of the time, they just really we're telling them things, but they're not sure they can actually achieve it. So how do we really help to change their mindset and build up their resilience and perseverance so they can actually do and get the right outcome? This practice advisory is also a really good read, and I recommend that you take a look at that as well. The reason I'm sharing this is because even though we don't have the formal training per se, I love that ACOG is supporting, and in conjunction with the AAP, what we need to do in terms of being a part of that healthcare team. And if we are seeing our patients for their prenatal care, then we need to be planting those seeds. We need to be priming them to be thinking about that infant nutrition. A goal without a plan is just a wish. So you can't wish to breastfeed well. You really have to work for it. And so really how we help that. I want to give a shout out to Epic and their resources. There's some pamphlets outside. If you've not been on their website and checked out the material, very important, very resourceful, easy to access, easy to review. They have a lot of recordings. You can do that while you're driving. I do a lot of driving, so I listen to a lot of things, so you can use your time wisely. But I got a little jealous, so I went through the website, and they're connected, of course, to AAP, and so they have all this information. They have practice management tools. And then when you go to the next page, it's for pediatricians. Well, guess what? My ACOG site does not have the same page, and my Georgia OBGYN Society does not have a similar page, and so maybe by next year we will have one. But really, if we want to think about how we integrate breastfeeding support in our obstetric practice, this is the kind of easy access that we really need to promote. So for now, we'll just be using the pediatric page, but I think we should have our own page. Don't wait until you're in a crisis to come up with a crisis plan. That applies to most everything in life, right? It's the reason you keep Band-Aids in your purse. It's the reason you have a needle and thread in your purse. I have a lot of stuff in my purse. But you really want to be prepared. If you've gotten to a bind before, you want to be able to do that. And so our patients really need to approach their infant nutrition with that same vigor. And we can do that if we give them the tools that they need. So let's talk about the development of our plan. So setting your breastfeeding goals. One of the things that I find very interesting is when you're younger, people ask, well, what do you want to do when you grow up? You're always setting goals, and what's your plan? And, how are you going to achieve your plan? Well, that same conversation that you have with your family, excuse me, or even friends is something, excuse me, that will easily happen with your patients as well. And so, as I mentioned before, having short-term goals would be good. Being able to help people get through, how to latch and how to position and things of that sort. And so there's actually a breastfeeding goals worksheet, and I kind of screenshot for you to be able to see that. Excuse me. So I want to start with this plan first, because I think it just outlays what is available to patients. Thank you. Thank you so much. Thank you for the water rescue. That was great. And so, your long-term goal, how many months are you thinking about breastfeeding? How many months are you thinking about exclusively breastfeeding? Writing those numbers down will actually help the patient because it's something that's visual. But I like to write things in pencil. Almost always use pencil when I do things because you can change those things. So once they meet that goal, then they can extend it. They can go to 8 months, and then they can go to 10 months, and then hopefully we can get them closer to 2 years. So really thinking about that. When you think about the short-term goals, how can patients achieve those goals? What resources do they have in their community? Are they able to go to something in person, or do they need to go online? And there's lots of stuff online now, and so really, I use the term all the time that the quality of care that our patients access should not be limited by their zip code. And because of the internet and because of all the resources that we have, that is actually able to happen. On that last page, it goes through some very specific things where we think about what we want to happen in the hospital. Should the patient end up needing to have a C-section to have a safe delivery, then what does that mean? How quickly can we get that baby to mom for that golden hour? What needs to happen in terms of rooming? Is it a breastfeeding-friendly hospital? These are all things that we can help the patients to think about in advance. And the reason that's important, too, is this plan should really travel with the patient. It is not uncommon for people to travel out of town and then end up delivering, and then what? So I would tell my patient once they make their plan to take a picture of it so they have their plan with them wherever they go. But again, it's just having that roadmap in your hand so that if you're having a day where you really are falling apart, you can look at your plan and say, okay, I promised I was going to do this for 6 months. What can I do? Let me go through this list. So this is a great example of a plan. If you don't know where you're going, you'll end up someplace else. And so that's true, right? Thank God we have GPS. It's kind of funny how we talk a lot about distracted driving now and not using our phones. But do you remember the MapQuest days? Like, what was more dangerous than that? Here's another infant feeding plan. And I love that it has options so people can individualize what might work for them. We have an exclusive breastfeeding segment, no bottles or pacifiers, skin to skin, feed on cue, routine exams, emergency C-section, rooming in, breastfeeding assistance, breast pumps, discharge bags. I mean, this is a pretty good list, right? And so what we want is our patients to have access to the information so they can find the plan that will work for them. And I love that they have that in this picture. I think that's really nice. Plan your work and then work your plan. So here's another overview. So looking at, again, just how it's organized, I love how on the bottom of this first page, it has the healthcare provider, the phone number, the contact information. This is actually a plan from WIC, and I love that because we really do need to be utilizing our WIC resources. One of the things that's interesting is even though we may not have women's health coverage or OBGyn access in more than half of our counties, we have a health department in every single county in our state. And so we really need to be utilizing that infrastructure to really help our patients access information. And it's important for us to change that perspective where, the health department sometimes is viewed as a place where you go when you don't have any other options, but really, they kind of should be the first line. And if they have WIC representation, they have lactation support, we really want to incorporate them into our plan for how they are able to achieve what they need. If the plan doesn't work, change the plan, not the goal. I love this quote because really we have to get our patients to focus on what is their goal. How do we get milk to that baby? And it may be that you end up pumping like I did, and now we have all the little fancy pumps. You can put them under your shirt and walk around and do stuff. I mean, what could be better? Things have come so far. So I think it's important for us to continue to really support our moms. This is Nuvance Health. They also have a really good plan. And I think it's really interesting. At the bottom of the first page, it talks about the cost savings per month. I think that will get some people's attention, right? Thinking about how much money they'll save. Also the medical cost for illness and sick visits. So really, there are different ways that we can attract people. What's interesting about this plan, they have exclusive breast milk or formula only. And I think it's good because we are not stigmatizing those choices if in the event that is the best thing for that baby. And so I think when we offer patients options, they feel like they're a part of that decision. We hear a lot about shared decision-making, excuse me, but when it comes to breastfeeding, it's really more informed decision-making because it's our responsibility to teach them about all the options and how things may change so that they can then make the right decision. And sometimes, well, not sometimes, a lot of times, patients are making decisions to discontinue because they're not completely informed. For example, they may be taking a medication for mastitis and they think they cannot continue breastfeeding. That's something that we need to be able to address. That's going to come from that clinical provider who can help them work through the challenges and also help them not respond to misinformation. Without goals and plans to reach them, it's like a ship that has set sail without a destination. I think you all get the point. I found one great Google article that had all these quotes. I just copied them all. So the utilization. So, I love this website and it's balanced breastfeeding, and I love that term, balanced breastfeeding. Such a nice concept. And I like that they have breastfeed, bottle feed, and pump. Again, we're giving people options and we're gonna help them optimize. And it may be something where they're doing one thing for 2 months and then when something else changes, that's different. So when I had my daughter in residency, I was home for 6 weeks, and I went back, and I did much better on breastfeeding the second time around, and so I had stored up all this milk in the freezer. And so I sent my daughter to Birmingham with my mother-in-law for the first 2 weeks so I could transition, and I sent all her milk with her. I felt so good about that. And so really just thinking about how we're able to, so she was gonna be bottle feeding, but she was still getting my milk. And so giving our moms that support for whatever they can do to help baby get that breast milk is going to be important. I think it's important to think about also access to classes. Not enough patients are really taking advantage of that. I feel like we spend a lot of time on a lot of things, but the things that really are important and that we can impact don't get as much support. And so are we asking patients at every visit, have you had your breastfeeding class? Let me sign you up. Or is it something where we have an iPad in the room and while they're waiting on us, they're watching the video while they're there? Could we not do that? So these are things that are not rocket science. It's much harder to go to the moon, actually, and much more expensive. But really, just being creative about how we're utilizing patients when we have them, their catchment, when we have them in our hand. And this is where actually I got the idea from for the 28 weeks was actually from that article. So this was the postpartum vision board, and I really think you should check this out and download the options. Very nice. Now, I don't know that I'm that detail-oriented because they can put pictures and things like that, but I love the idea of patients painting a landscape for what they want. And I think it's important because this is postpartum. So that's going to include your mental health support. That might include some pelvic floor therapy support, depending on what kind of delivery you had. It's going to include that breastfeeding. And so really, patients have a chance to really think about that picture. This is also a great opportunity for us to infuse the education with our caregivers. You know, when we think about our most recent maternal mortality report and we look at our maternal deaths, most of them happen between 6 weeks and 365 days. That's that postpartum period. So what a great opportunity for us to really help our patients visualize what that should look like and what's not normal, and help them kind of select how to optimize their health during that time. So I like this slide as well. What stage are you in? And so, you know, learning, are you thinking about breastfeeding? This is a great way to have a conversation with a patient. Once the baby is here, you know, reading about what to expect in the first few days. I think that's really important to break that down. Overcome, every mom faces breastfeeding challenges. Even if you have a mom who's a G6, it may not be the same. So we should still be giving her the same kind of support and attention, just like we would have been doing if it was her first baby. And then thrive. And I love that term. We don't want our moms just to survive. We want our moms to thrive, which means we have to change the culture, the environment, the ecosystem. Everything that is going to be a distraction from mom needs to be addressed so that she can overcome things and so that she can thrive. I'm wrapping up now because we'll have time for questions in a little bit, but I love to read. I have a book addiction, actually. This is one of my favorite books that I just finished reading, and there are lots of good quotes in here, but I really wanted to give a shout out to everyone in the room. So you've taken time out of your day, you've probably driven lots of miles, and you probably could be doing something else right now, but you have decided to spend your time here to learn more so that we can help the women in our state. And so it's important for us to remember that we really need to be working with each other, and sometimes that happens physical contact like we're here in person today, or sometimes it's on Zoom like I know Dr. Bird and we talk all the time and I don't have her phone number because we Zoom so much that I just know her, but I don't have her number. So really, but we get energy from each other and we learn from each other. And so as you are learning things that are working for you and your patients, we have to find a way to share that information. It's probably not necessary all the time for us to reinvent the wheel, right? We can use the resources that we have. And really the goal is, how do we optimize utilization of the resources that we have? We have GaPQC, lots of resources. We have EPIC, lots of resources. And so sometimes it's a little frustrating because people will say, they look at the numbers, well, you know, why aren't our breastfeeding rates better? And why isn't our maternal mortality better? And we really do have to step back and think about that. Is it because we need more money? On some things, probably. Do we need to change our access to healthcare infrastructure in our state? Probably. But do we have enough, and are we using it well enough to be able to help improve outcomes for our moms? And while we can look at that from a community standpoint, I want you to think about each individual interaction that you have with your patient. And you are not going to win all your battles with every single patient. But when you go back to your clinic or your setting, the patient that you interact with, how can you help to improve things for them? And how you build that relationship, how you maintain that trust. And when we think about trust, you know, sometimes you're building new bridges of trust, but we spend a lot of time repairing bridges because of previous experiences. And so keeping that lens in mind is also important. I told Claire that I had a surprise for her, so I don't know how many Swifties we have in the room. However, did you know that Mastermind had this real nice quote about if you fail to plan, you plan to fail. So that applies to breastfeeding. So for the Swifties in the room, I do have that. If I had access, I would play the song for you, but you can look it up later. But I did want to give some cultural context to this conversation. Lots of resources here. This is not everything. A lot of things are hyperlinked. I want you to leave with this in mind, and of course you can fill in the blank if none of these serve your patients well, but we need to be doing this early. We need to be doing it often, just like how we think about breastfeeding, right? Early and often. Same thing with our counseling. We need to utilize those opportunities, and we really need to be encouraging that conversation so that patients are preparing for those challenges and we have what they need. Do they have their lanolin? Do they have their the nipple guards, like whatever it is that we need to help our patients be successful, we need to be working on that. Important reminders, I love this quote as well. I told you I love quotes. There are probably like 20 quotes in this presentation. But you want to plan purposefully, prepare prayerfully, proceed positively, and pursue persistently. I think that captures exactly what we need to do and how we can encourage our patients. Thank you so much for your time, and I want to just end with my quote. And like I said, when you go back to your community, to your clinic, whoever you're interacting with, sometimes it's good to zoom out when we think about looking at our state plan for breastfeeding. More often than not, it's good to really zoom in and focus on the patient that you have in front of you and how can you make a difference for them and how can you impact that mom, how can you impact her family. And we know that when moms dazzle, everybody shines, right? If mom is eating a salad, everybody's having a salad. I have no Gatorade in my house. My daughter is mad, my husband is mad, but they drink water because I didn't buy any. It's great. So when we empower our moms, physical health, mental health, spiritual health, they do what they do best. We don't have to tell moms how to mom. We just have to help moms be healthy. And when we help our moms breastfeed or optimize their infant nutrition, we're contributing to that, and then the impact is limitless. And that's the end of my presentation.